the meeting. Jill did it for me, so Jill. Welcome everyone to the Performance Measurement Learning Collaborative. I'm really looking forward to hearing from Leanne today and others who are willing to share. I want to go over the agenda really quickly, so I'm just going to share my screen. And I'll drag this in. Okay. So, first of all, we'll welcome and introduce ourselves again. We'll do it really briefly. And in fact, the way I would like to do that, we'll start right here, is ask people to, in the chat box, if you can just write in your name. And I'd like you also to write in, or if you feel more comfortable unmuting yourselves, I'd like you to share what is your greatest challenge in measuring collaboration or systems change. So you could do this in a few words. If you wanted to speak, that would be fine as well. But I'd like to hear about your greatest challenges in measuring collaboration. So just feel free to use the chat box. And I'm going to actually, oh, I never did share my screen, did I? Sorry. So if you could just put in chat your name and who's here and what is your greatest challenge in measuring collaboration? Jill, I can't see my chat.
I'm not seeing anything in there yet. Have people entered something in the chat?
Thinking. So just in a few words, what's your, and I'm gonna put in mine. Ronell.
Yeah, I was gonna say, I just put mine in, so I hope it's there.
Right. Still learning your job, still learning the job. So hopefully we'll get some ideas today.
Yeah.
Guess no one has any challenges.
No one has any wait, no, let's do collaboration, getting busy people's schedules to align. Man, that's a big one. It's like herding cats, getting follow through and staying on schedule. And I just put in mine, collecting the right data, knowing exactly what I should be collecting. Oh, Susan, this is a good one. How does one measure the extent to which partners are committed and find meaning from their contribution and feel valued? Lynn, greatest challenge is quality input, good data. Yeah. Val, making sure we are using the right tools. Greatest challenge for Marilyn is identifying measurable quantitative objectives. Deanna, confidence that we're measuring it correctly. So confidence is important. Making sure we're using the right tools and measuring correctly. Hi, Abby. Thank you. And the chat has slowed down a bit. So I'm going to go back to sharing my screen. And I'm hoping that some of these challenges you're facing, I think Leanne might be able to shed some light on how they're addressing that in New York. And then we'll make sure we have time for further discussion about that. So this time I'm really going to share my screen. So I hope you can see it. Can you just let me know if you see the agenda on the screen?
Yes.
Okay, good. So welcome and introductions. Here's the agenda for the rest of the day, or the rest of the morning, sorry. Leanne Winchester graciously agreed to share how they're measuring collaboration efforts in Massachusetts, how they developed it, and the evolution of those strategies over time. Then we want to check in, and Arch may have some updates related to performance measurement, and also any Learning Collaborative participants updates or areas of discussion. I also put down something that Marilyn Sword brought up months ago, and she's wanted to talk about outputs or outcomes. I put down what counts and what matters, and I'm going to share a little bit about this, sort of a mini presentation, and I saw Marilyn raising her hands, and then hopefully we'll have a lot of discussion about that. So, and then the last item on the agenda is to plan future meetings. So I'm going to stop sharing, and I want to hand this over at this point to Leanne, who's going to share with us what they're doing in Massachusetts related to measuring collaboration. So Leanne, I'm handing it over to you.
Hi, hi Cassandra. Hi everyone. It's a pleasure to be here and to share with you what we are doing in Massachusetts. And I will say that this is an ongoing process. I wrote down all the comments that everybody had shared. I think it would be helpful for me as well as we move forward in our process of measuring the collaborative or the collaboration within our state partners. And so just a little bit about me. I am the director of the Massachusetts Lifespan Respite Program. Amy Nazir from the Department of Developmental Services is our principal investigator. She has the long-term history with Lifespan, and she and I work very closely together. And within the state, I am a registered nurse, project director of workforce development and policy. I work very closely with state partners to look at workforce career lattices and opportunities and funding within the state. And of course, that does also include our respite workers. And so this is just really great to be here. So I'm going to share my screen, and hopefully I did put together some slides because I have a tendency to veer off. And so can you all see that? Yeah. Okay, yes. Perfect. Yeah, great. Okay. And so this really does help me to keep myself on track. And so I don't know if there are questions going forward. If you could just put them in the chat. I will not be able to see the chat, but I think if Jill or Cassandra or somebody could just monitor that, we could talk about it at the end of my presentation. I do plan on keeping this relatively quick so that we can get into a much deeper discussion, which I think is where we really learn from one another. And so in Massachusetts, we do look at collaboration as the powerful strategy. And I think we can all agree on that. This last statement here, however, it's a hard term to grasp. And from our experience, and we all understand the term collaboration. We all know that it's powerful and it's important that we collaborate in everything we do. But exactly how do we determine whether or not it's effective? And so this is what we're doing in Massachusetts, is really trying to measure its effectiveness. I will say, when we came together with our state action group and we explained to them that we were going to be measuring collaboration, specifically as it related to them as state partners, we sort of got a lot of puzzled faces. People weren't sure what we were measuring, but as we continue to move forward, it's definitely making sense to them. So, I'm really thrilled to be able to share this with them and you. So how did we get here? Well, I do want to say, back in 2014, the Massachusetts Lifespan Respite Project did a caregiver survey, and this shouldn't be surprising to anyone. They had done an online survey. 380 caregivers did complete this survey, and it did show that there was a need where family caregivers identified a need for access, the effect on their employment, and their financial burden. And so, you know, as the coalition had come together and we had looked at this, this was really important for us to acknowledge. We've seen data on these different things throughout the country. Other programs have done this. And so, but this is what we saw in Massachusetts from our caregivers. And so we took this and we spoke with the group about it and how are we going to increase access and support family caregivers on employment, and how are we going to, you know, look at state programs to alleviate financial burdens. And that was good. And we all began working. We did hit some roadblocks, which brought us to 2017, where myself and a couple of colleagues, we did some research, and we actually did an environmental scan of all the state policies in Massachusetts, because as we were hitting these roadblocks, trying to determine, you know, where our next steps were, what we were finding is that there was a lot of variability from different state programs. And when we were looking at statutes and regulations and funding streams, everybody more or less worked in a silo. We did acknowledge that, or reported back that the 4 primary areas of variability across Massachusetts was specifically the types of respite services that were offered. And not only the types, but as well as who were the recipients of respite. Sometimes it was called respite care, sometimes it was called respite service, sometimes it wasn't called respite at all. However, when we looked at the definition, it did align with the term respite. And so that led us to acknowledging that every state agency had a different definition of respite. So when we said respite, everybody interpreted that word differently. And then also the methods on how they track their referrals and their delivery of respite services varied. Some did a fantastic job, others didn't do as good of a job, but wanted to do a better job with tracking. And so all of this resulted in us in Massachusetts forming what we call the Caregiver Respite State Action Group. And so as a group, we came together back in 2018, and these were the state agencies that comprised the group. Now, all of these agencies, well, I should say the Executive Office of Health and Human Services is sort of the umbrella agency, and those that are below it, Department of Children and Families, which is our child welfare program, Department of Developmental Services supports individuals with intellectual developmental disabilities. The Department of Mental Health, both for children and adults with mental health diagnoses. Department of Public Health, specifically our early intervention and our children, youth with special health needs. The Executive Office of Elder Affairs, Mass Health, which is our Medicaid program, and the Mass Rehabilitation Commission. So all of these programs or these agencies offer some type of respite. And when I said that everybody defined it differently, these were the programs that we spoke to. And so when we spoke about how they track and they measure and how they deliver services and who are the recipients of the services, this is where we also saw the variability. I have the University of Massachusetts Medical School. I represent Commonwealth Medicine, which is an arm of UMass Medical School, and there are a number of state supports coming out of the medical school, as well as how we educate our medical practitioners. And so again, so everybody convenes, and this is where we decided that we needed to measure how this group works together in order to meet our goals, not only as a state, but also as our lifespan respite program. So early on, we did a pre-survey of all of the different program managers. And this was a follow-up to the study that I had done with my colleagues back in 2016, 2017. So this was just when I did that initial survey, we did key informant interviews and surveys of agency representatives. Now I was talking to the actual managers of the different programs that would offer respite. So a little bit of a different eye, but still the same program. And then from there, we use this tool, this collaboration tool, which is the Levels of Organization Integration Rubric. And so this came out of a study from Rebecca Woodward. She did later on get married, so her name changed to Rebecca Gajda, Gajda, if you wanted to look her up. But so she had formulated this tool, Levels of Organizational Integration rubric. And this is the tool that we adopted to really assess where the different agencies fell within collaboration and how they worked with one another. And I'm going to get into that shortly. But we did the assessment during 3 phases. The first phase was the initial phase right at the very beginning of our project. Following, we did the pre-survey first. And then after we did the pre-survey, we got everybody together and we did an initial LOAR measurement. Then we did a mid-grant measurement, which was done just before COVID hit last year. So it was done in January. And then our final measurement, we're actually doing now. And I'll talk about how we've had to transition our final measurement into an online measurement. And so the research questions that we're asking with the LOAR is, what is the current level of collaboration? What is the needed level of integration? And what is the expected outcome for the state group, which really did look at our goals. So the pre-survey, when we did this initial pre-survey, what we found was we had looked at 6 primary agencies, and it's the DDS, the DMH, DPH, Elder Affairs, Mass Health, and MRC. DCF is our child welfare program. They did not complete it, and I will say that this is a very unique program where, as it relates to like respite services and respite companions coming into the home, I will share openly that we've had challenges with getting them to the table just because of the issues going on and how their program is just slightly different. However, they do participate in discussions and they do receive all of the notices. They have participated in coalition meetings, but as far as getting them to the table, it has been a little bit challenging, not as terrific as we'd like. So it's a process. Everything is a process. So 4 agencies did respond. And so it confirmed that the variability of the definition, and that respite, when we speak of respite, they predominantly see that it's respite is available for the individuals with disabilities. So when we spoke about the family caregiver, it was something that they needed to really process and marinate with that thought for a little bit, because that isn't really who is the recipient of their state funded services. They had shared that there were different types. There was planned respite, emergency respite, in and out of home respite, and or facility based. And so some of the programs offered just one, and other programs offered a combination of those 4 different types: planned, emergency, in-home, and out of home. And there was no standardized respite training requirements across any of the agencies, and tracking, as I shared, was inconsistent. And only one agency had respite specific public facing materials information. And we had a lot of conversations about that. So as we were explaining to them that we would be measuring their collaboration, we had to really drive home the principles of collaboration to help them to understand, because as I said, oftentimes we would come together, we'd be sitting in one of the conference rooms in the state building in Boston, and for the most part, all of them felt that they had always been collaborating. Nobody had ever measured it before. And so what we had shared was that collaboration depends on positive relationships. And we're going to really see how this can be challenged. It was quite interesting. And that collaboration develops in stages. And so we spoke about this, and we had a lot of them nodding their heads, and they understood, and that was good. And this is where the conversation started. From there, we explained that in order for us to accomplish our goals and to really look at meeting the needs of the family caregivers, is that the collaboration is an imperative. It's absolutely vital that we as state partners must, or state agencies must, come together. that collaboration is a process rather than an endpoint. It's not as if, okay, we're going to collaborate, we're all going to come together, and there we are. Now we're collaborating. It really is a process. And that the strategic alliance, which is what our state caregiver group is, they are the strategic alliance, and they are intentionally created to benefit the partners themselves and ultimately the stakeholders of the family caregivers in our regionally and locally based respite provider programs. And so I will say, when they were intentionally created, Amy and I had reached out one by one, speaking with the different agencies and asking them to identify who within that agency would be best to sit on our team. And so we were very strategic, and it did require a lot of phone calls, a lot of emails, and really explaining why it was important that they show up at the table and how it would benefit them and their program and their, the clients that they serve. And so, it just wasn't, we need you to show up, and they showed up. There was a lot of hand holding and getting folks to join. So once they did come together, we did form a shared purpose. Of course, we had our goal within our funding for the Mass Lifespan. So we did have our goal, and we shared that goal with them. And we had a lot of conversations at our initial meeting on the shared purpose and also the complexity. And so there was a lot of complexity as far as interorganizational, how they work with one another, as well as intra-organizational and the different programs within one state agency. So for example, with the Department of Mental Health, there was Children and Adult Services, and then there was Children and Youth, and then there was adults. And not too often the two should meet. We also had inter-organizational, so within Elder Affairs, we had Grandparents Raising Grandchildren program, and then within our DCF, we had our Grandparents Raising Grandchildren, which really looked at the child. And so how, the complexities of how those two programs work together. And I will say, from our initial meeting, as we were sitting around the table and talking about our different programs, there was a lot of ahas and a lot of, surprise looks of, I didn't know you did that. Oh, well, we're doing that too. And this is really where the value was. So as we had previously said, that collaborations develops in stages, we actually explained this to them using the Bruce Tuckerman's model. And this is the forming, storming, norming, performing, and transforming model. And we had explained to them that it was very important for them to understand, and for us to understand, that once the group is assembled and formed, the work is not done. The work is just beginning. We got them, we identified who needed to be there. We got them to the table, and that was the initial phase. And that as we continued to work towards meeting the goals, that we expected the group to go through the storming phase. And I will tell you, we definitely went through a storming phase. Like in many relationships, once you get through that storming, if you're in the midst of that storming phase, it's oftentimes you see the groups will break up. And so we had to explain to them early on, we want them to go through this storming phase. We expect that they will go through the storming phase, and we will not be surprised when we get there. Doesn't mean it makes it easy. It just means we expect it. And so what would the storming phase be? It would be where one group might feel as though, one agency is dominating this agency, our agency isn't represented enough. It might be where some would say, we're doing all the work, they're not doing anything. There were all sorts of things that would come into play. When the group goes through this storming phase, after they get through it, they would enter into a norming and performing. So it's, you identify the challenges, as I will say, as the leaders, Amy and I did a lot of individual calling and talking with different state agencies in really letting folks have the time to air their concerns and their grievances, because there were some. And they, like I said, they are expected. It's part of growth. So we would come together, and it's once you get through all that and you come together, this is where the performing can really begin to happen. And once that performing begins to happen, that's where we would see transformation and you know, an achievement of our goals. So it's pretty exciting to see all of this happening, but it's not necessarily easy.
May I ask a question now, Leanne, or do you want us to wait?
No,
I
go
can
ahead.
go back to that last slide, if at all possible. I have a bunch of questions and I'll save them for much later, but basically, how long did that process take from once you were assembled, you'd done your interviews, you'd brought to you felt that you were at the level 4?
So I will get to that, but
Okay.
yeah. And so it's not linear like this description shows. It's very curved, and actually looking at this felt that, you know, we should really change this because it's not an arrow going up. But, you know, so when I would be discussing that, I'll be actually showing you what happened with us.
Thank
Yeah, no, it's great. Thank you. And then we just explained the attributes. So we as a group had our goal, and we were evaluating our collaboration. We had a lot of dialogue, a lot of decision making, which I will go through, and then the action, how we would actually, what actions are we taking in order to meet our goal? And then how are we continuing to evaluate that? And so moving forward, I don't know if you can see this, but this actually is a description of the LOAR. And I don't know if there's a way for me to make it bigger, but I will say the LOAR, looking across the top, there are 4 primary areas that we are measuring within the collaboration. It's the purpose, how the state agency defines their purpose for being at the table, and looking at the strategies and tasks, how they would measure their role with the other state agencies, with strategies and tasks as it related to meeting our goal. The leadership and decision-making, where do they feel, is it equitable between themselves and the other agencies, or is it hierarchical? And then also interprofessional communication. So we'd ask them to measure it. When we're at the scale of measuring, it's actually a 5-point scale with 0, meaning that there is essentially they work independently of the other state agencies, to networking, which is level 1, which is rated as 1, where they feel as though it's very loose, some flexibility, not really defined. We know one another, we like one another, but it more or less ends there. To cooperating. Cooperating was where some agencies felt that they had some level of commitment with the others. Maybe they've done things in the past, maybe it's worked out, maybe it hasn't, but they cooperate. To partnering, where they're actually now beginning to share resources, formulate ideas together, and forming these strong communication systems. To level 4, which is unifying, which is really where there's high level of commitments, a lot of communication. The investment is high, there's shared decision making. And so, this is the tool that, the outline of the tool and the description of the tool, as far as how the measurement is done. And I will say this is just a simpler view of what you just looked at. And so it really does measure the level of collaboration across the state action group, and the LOAR pinpoints the attributes across the 5 levels. And as I said, the independent, network, cooperating, partnering, and unifying. The value of this tool is that it did enable the group to understand the level of communication and collaboration that is definitely needed in order to meet the goals of this project. And so, and I'm going to show you in just a minute what the results were. But the first thing, as I said, was that we did the initial low R measurement with them. And then, we determined the goals of the project. Then we did the low R. We recognized from the pre-survey that we needed to have a universal or an agreed upon definition of respite before we went forward. This is the absolute first thing that we had to do as a group, was define what is respite and who are the recipients of respite. And I wish I could say to you, this was just easy. We came together and we did it, but I'm going to tell you, it took us several months of very intense conversations to arrive at the definition of respite. And so respite in Massachusetts, they determined, is planned or emergency support to provide family primary caregivers with a short break from the exceptional demands of caring for individuals with complex needs across the lifespan. They did ask that each agency would be able to further define what the term emergency means as it relates to their regulations, what the support means, whether it's a companion aid or an in-home, or an out-of-home placement, who is the caregiver, the special needs. We had a lot of conversation on special needs, especially as it relates to older adults that have needs but may not be termed as special needs. And then what is the term exceptional? And so one of the reasons why it was so challenging for us to arrive at this definition is because, remember, primarily respite was a service that was for the individual with the disability or the care recipient. It wasn't necessarily outlined that it was for the family caregiver. So we had to have a lot of conversations, a lot of meetings, a lot of discussions as to what this, who the recipient was and what respite is. So we did arrive at this, and we continue to use this, especially as when we're talking with our program providers and then any other work we're doing. So we arrived at this definition. They all adopted it. We shared it with the Fuller Coalition and the different agencies. And then from there, after the initial OR, we did a SWOT analysis. And so from the SWOT analysis, this is again, another way of measuring, or for us as a group to look at what we needed. And so for the strengths, they determined that the agencies and organizations were already aligned and already existed. Didn't necessarily mean that they had strong relationships, but that they were definitely aligned. They did also acknowledge one of the weaknesses is that there would need to be a tremendous amount of education, especially as it related to the definition. There were lots of opportunities to create a system and blend rules within the No Wrong Door. And then the threats were the loss of sustainability and the loss of state funding as we continue to build programs. And so these are things that we looked at. And so to answer Cassandra's question, we formed the group January 2019. We did the pre-survey, but we had our first formal meeting in January 2019. And it was in late February that we did the LOR. And it was around April to November that we started going through the storming phase. So you can see it was relatively quick. We formed, everybody was exciting. Once we hit April, this is around the time where we started looking at the definition. We started looking, we formed the definition. Now we had to do the SWOT analysis. We needed to look at the goals. Definitely went through a storming period during that first year. Then as we hit November 19th to January, so really in just a 2-month period, we sort of, and I would say it's more of like January, late January, February, that we came to an agreement. And the group really started to accept everything that was happening. And you can see the Transform and Adjourn is still open because when we hit January, February, of course, then we all know what happened with COVID and everybody was pulled in a million different directions, myself included. However, what was really exciting was because we were measuring this and we acknowledged everybody's role during that storming period, we had eased a lot of tensions and had begun to really form this group when we came together in December, January, when we were working together, you definitely saw that folks were invested in this process and excited to move forward, which did sustain us during the COVID period, because it was during COVID this past year where we actually have been doing our best work, and which I'm not sure if we had not gotten through the storming period, my sense is that the group likely would have disbanded, and we would not have been able to accomplish everything that we've been putting together. So here's the exciting part. This is what the rubric looks like. This is the results. And this one actually was taken January 28th of 2020. So this is the second one that we did. And I want to show you what was interesting about this. So if you look at the top is all of the state agencies goes along the top. We have Elder Affairs, EHS, which is Health and Human Services, the DMH Adults, DMH Children, DCF, which you can see is blank, the DPH, DDS, Veterans, also blank, MRC, again, Mass Health, and then UMass. And down the left-hand side column, it is the same state agencies. And so how it works is that each agency will start with Elder Affairs, which is on the far left. Going across, Elder Affairs was asked, and this is a subjective measurement, is asked to determine what they feel is their current level of collaboration with Health and Human Services, and what do they feel is their projected level of collaboration in order to meet this, the goals of this project. So each state agency is asked to measure or determine how they feel they're currently collaborating with them and what they feel they need to get to. Now, what was really interesting is that some state agencies, they measured each other differently. And so that was real eye-opening when we saw that. And so it did allow for a lot of communication. And then at the end, we took the average. So the average level of collaboration with this group for current was 1.54. Now that was in last January. So you can see, just looking at this chart down here, 1.54 is between networking and cooperating. And that's where they felt like they were at that point. Now, remember, we just got past the storming period. So they felt like they were in the networking cooperating phase. They felt at that time, at last January, to meet the goals, they would need to be between cooperating and partnering. They felt that they really needed to be, a little bit stronger as a group. And, but I think what was really, really interesting is when we, as the leadership group, took a comparison and we measured based on the initial to the middle one, that the numbers actually went down. So initially in year one, their LOAR score was a 1.81, which, it was better. They felt that they weren't so much as networking, they were closer to cooperating, and that they projected that they would need to be stronger towards partnering. So we did see that the numbers went down. And as we looked over the course of the year, what we found was that there was a lot of transition during that storming phase. There were some partners that were part of the group and then stepped out and somebody else came in to replace them. And that was one thing. There were other times where I will say some folks were just very frustrated. So where they thought they might have been stronger with that particular agency, the second time around, they measured them a little bit lower. And so we definitely saw that. So there was a lot that had occurred. But what was really exciting for us is that they both, during both times, they were similar on what they felt the projection was, and that it needed to be within closer to that partnering stage. Like I said, we are in the process right now of doing the third assessment, and we're transitioning over to an online survey. And I think what will be interesting is following the report of the second LOAR and showing them all of this and having a lot of discussion. They really began to understand what it means for collaboration when we were going through the storming period, and we would explain different things to them. It brought on a lot of respect for one another, and it was important that they felt that there was a safe place for them, that they could, you know, really air their thoughts and things like that. And so there were a lot of personal relationships that were formed. And I will say, when we have our groups now, there's a lot more laughter and a lot more agreement. And so, but looking at all of this, what we pose to the group is, if the projected level of collaboration is cooperating, partnering, what's the evidence that would indicate that we've reached this level of collaboration, and what actions are needed? And so this was a discussion that we had last January, February, right before COVID hit. And we got everybody together. We went back to that SWOT analysis. And from that SWOT analysis, we formed a future vision. And this future vision is something that they all had input on. And we did also meet with our community partners on this for the full coalition meeting. And everyone agreed that we needed to have a centralized place so that family caregivers could access respite, because remember, that was one of the things that the family caregivers had identified as a primary need. That we needed a full service website. We needed a system where all programs are aligned, because remember, when we first started, we had pointed out to them that they were all working in silos and the definitions were different across agencies. So they agreed that they needed to have knowledge of each of the provider services. And that was pretty evident when we were talking about the Grandparents Raising Grandchild's program or grandchildren program, is that there needed to be knowledge across services, that there needed to be sufficient staff that could respond and support the family caregivers, and more access to respite providers, that the respite workers needed to be well informed, hence a training, because that was not something that they had necessarily had. There needed to be a common view that respite workers are valued, and needed to be more formalized training for the workers, as well as cultural and regional representation in the workforce. And so this is really, this future vision is something that we continue to come back. So when COVID hit and everybody, you know, meetings got canceled and things like that, we had this vision and we had this measurement of collaboration that we could keep bringing them back to. So when we transitioned to an online meeting format, we could really continue on with the work that we were doing. And so I will say, so from that, from the future vision, that what we had seen was that we needed to have a respite system where all programs were aligned. And so from there, what we've been doing this past year, as we have been working together to form and to develop an online training video. Now this video is specific for state agency staff and professionals that provide services for family caregiver, and it's for family caregiver respite services. It's a way for them to become knowledgeable of all of the different programs. It's an interactive online training. It's, you know, we are presenting it to the leadership groups. Hopefully it will become part of an onboarding process. And it really is meant to be sure that all of the agencies or all of the care coordinators are speaking the same language, so that it's easier for the family caregiver, so that they're not trying to navigate the system, which can be pretty complex. I will say for myself personally, I was a family caregiver several years back. My parents and my brother, their health was failing. And so my role sitting in the state building, I was trying to find respite services as a state employee, and I was having a difficult time trying to navigate the system. And so a lot of that has really fueled my passion moving forward, because if I had a hard time, I could only imagine what these family caregivers are going through. So we're hoping, it's our goal is that this training will serve to inform everyone. And then the other thing that we're doing is our No Wrong Door system, Mass Options, is our main respite resource for respite services and other services. But not all state agencies were using it or accessing it. And I will say, as we were presenting this information, some of the state agencies weren't even fully aware of it or recognized that it was a resource for them. And so now we were funneling all of this different state agencies through that Mass Options program. So that's another thing that came from this. And because we were able to get this collaboration formed and going through all of this period, they felt as though they could really voice their thoughts and their concerns and their ideas on how to best use Mass Options. And so we are in the end stages of this, and it's pretty exciting. And we're looking to roll everything out later this summer. And so I don't have the results of the last LOAR measurement, but I will say I'm pretty confident that we are going to move past the partnering, and it would be more unified, because it's definitely evident from this group is that they are a unified group, and they've been working extremely well together. And it's been a pleasure for me getting to know them and to work with them. And so I hope this helps you a little bit. This is what's been working for us. And so I'm happy to take any questions.
Thank you. That was fascinating. I'm going to keep my mouth quiet for a little while because I have a million questions, but I want to leave it open to the group. Feel free to put it in chat or unmute yourself. We'd love to hear your questions or comments.
Cassandra and Leanne, I've got a question. So Leanne, how did you get people to come to the table in the first place? Like, what motivated them to even engage in this really big deal? By the way, it's wonderful. I love the presentation. But you know, there's something that's not visible. Like, how do you get started? How do you hook them?
That's a great question. It really was individualized across different programs. And for me, I really felt that one-on-one, I needed to explain what we're doing. I needed to first be aware of what the program was. Now, I did have the benefit of doing the initial study in 2017, so I was already familiar with the program. And so I could explain to them what was in it for them, essentially. I mean, why it was important for them and what they would gain for their program to be in it. And I mean, that sounds sort of like, well, we're all public servants. That's why we're in this role. But if they're going to invest a lot of time at the end of the day, there has to be something that they can take away. And so that was sort of, that was the initial, is being aware of their program and how this collaboration could support them in their role and those that they serve. And yeah, and so that was really it. It's just, I think it's all about selling it, you know.
Thank you.
Any other questions from the group? And feel free to put it in chat or go off mute. So I'm just going to fill it. I have some questions. One, those initial interviews you did by phone, did you have any kind of interview protocol that you used? And if so, can you share it with the group? Because some people just don't know where to get started or what to say or ask.
Oh, that's a great question. Nobody's ever asked me that. I did actually put together a script, and that is something that I used. I'd have to go back through my notes, and it was once I was able to get them to answer the phone, I could quickly introduce myself and say who referred me to them. You know, I got your name from so-and-so, and I understand that this is your role, this is who I am, and this is why I'm calling you. And then just, I kept it very, very brief so that I recognized that their time was precious, and that, and so when I just explained that, you know, why I was calling and what I needed from them, oftentimes, not often, a couple of times they said, well, I'm going to have to get back to you. I need to speak to somebody. I'm not sure if I can participate. And then what I would leave it with, I'll call you next Tuesday. And I would send a follow-up email, thank you, and then remind them. And then I'd put a calendar invite on their phone, on their calendar, so that they had it on there. And just all of those things that, you know, again, just selling it. So I had a script that I more or less used because I didn't want to be, I wanted my thoughts to be very concise and to the point.
Wonderful.
Mhm.
I'm wondering, for other people listening to this, it's clearly a very thoughtful, detailed process that you stuck with for a long period of time because you needed to. Change does not happen overnight. I'm wondering if other people in the group, what would be the challenges of a similar approach? Or do you have questions about even the conceivability of doing it in your state, something similar? And again, feel free to go off mute or put your comments or questions in chat because I have more.
I was going to say, even while people are putting their thoughts together, I do have the luxury of living in Massachusetts. You can get from one end of Massachusetts to the other within 3 hours. And so when we were asking folks to come together, it's, you know, having face-to-face meetings at that time really wasn't that difficult for them to get there. You know, some of them may have driven, I think the furthest was close to 2 hours, but, you know. Yeah.
One of the questions I have, well, I have so many. Did it cost money to use the the tool you used? Did you have
The
to?
Loire? No, it's available online. And Rebecca Woodman was, she was a professor at the medical school and had done research there and had used it there. But no, I can share the link to her study, and it's actually within her study, right?
And how much training did it
Go
take?
ahead.
Oh, I'm sorry.
No, go ahead.
Okay. How much training did it take for you to be able to use the tool?
I was very fortunate. At the time, we had one of the evaluators that had worked with Rebecca Woodman on the initial one. So she was able to educate us and to move it. But the papers that Dr. Woodman had published does offer enough explanation in the paper on how to use the tool. And so, you know, just using Debbie Lang, who was the evaluator at the time, she's retiring. So anyway, but she had personal experience with Dr. Woodman on this study. So not too much for us anyway, as we continue to move forward with it.
Wonderful. I see Marilyn says, I think one of the challenges would be something Leanne identified at the beginning, dependence on relationships. And I imagine those relationships started from those first phone calls, which you had to do. And also, Marilyn mentions people leaving. That
Right.
must have been a huge challenge.
It was, and what I had to do, we had a few people, quite a few people leave. And what we did do was those that had announced that they were going to be leaving, it may have been that they were accepting another position no longer available. That was one case. So we would ask them to identify somebody within their agency that could step in and ask them to reach out to that person. There were a couple of situations where the person was frustrated and just didn't show up again. And, you know, so we had to really work through on networking and different people that were already in the group and asked for can you make a recommendation and things like that. But, there were just some people that were busy, and it was a challenge, but I will say we have a pretty solid group right now. And I'm looking forward to, continuing this group going forward. I think that, it's definitely something that they see has been beneficial.
Thank you. Is it okay for people to contact you, Leanne, if they have questions? I think some people may be shy on the call. I see Lynn says, I like the outcome of developing an online training video to inform state agency staff of respite services across the state. Yeah, that's good.
Yeah, that was, I think, this was something that they really thought. We initially thought, well, we're going to create a training for respite workers, or we're going to create a training for family caregivers. And there are those trainings that are available, but this was them saying, we really need to know about each other. I need to know what this sister agency is doing. And then we did have some follow-up focus groups with individual agencies. And this is where it got into the intra agencies working together. And they were saying, when we have a family caregiver calling and saying, help, you need to offer me something. They said, I need to know if this, for example, if the mom or the grandmother is raising a grandchild, they need to know what the services are at Elder Affairs. They need to understand the rest of the system to see if there's something that's missing for this family that they can help identify. So I was thrilled when they came together and said, no, we want this training. So it's like, great. Yeah.
So I didn't finish my question.
Oh, sorry.
No, because I got sidetracked by looking at the chat. But is it okay if people reach out to you? Yes, questions?
Yes, absolutely.
Right. I'm going to move on to the next part of the agenda, but thank you. And I learned so much, and it just drives home. This is a process that takes time, planning, and sometimes going back and starting over again. So you have to be committed. Anyway, thank you.
Yeah. Impatient. Yes, absolutely. Thank you very, very much.
Can I just say one quick thing too? Thank you, Leanne, for that, what I thought was an amazing presentation. And I want to go back to reminding everyone that the first requirement under the Lifespan Respite Care Grant Program is to develop or enhance a statewide coordinated system of respite. And I think most of us really never fully understand even what that means. So the fact that you took this incredibly thoughtful and deliberative process and came up with that vision at the end, I think there were 7 or 8 steps there that to me actually define what is a coordinated state life. And it's going to look a little bit different in every state, of course, but
right.
Just having these steps of how do you identify the people that you need to collaborate with? How do you encourage them to participate and show them that it's beneficial? My biggest question is, and this could probably take another whole webinar, so you don't have to answer it today, but I'm really curious how you got through the storming phase, because again, I think that's where you probably tend to lose a lot of people.
I'm from a family of 10. Grew up in South Boston in a 3-bedroom, 1-bathroom home. I think that I'm extremely patient and can listen. I was able to listen. So I think
listening, yes.
I will say we had really worked we had built in a lot of fun. With the vision statement, we came together, there was lots of food. I made sure that I fed them. We had agencies that had donated, but food and beverages, so that always helps. But I made it a sort of a game for them, and I said, we're celebrating at the end, it's the day after the grant and we've accomplished everything. What do you when you look back, what did we accomplish? And that's how we came out with the vision statement. on what they had a lot of fun. I will say there are some things that they came up with that I didn't put on the list because it was just brought a lot of laughter. And that was really the point, was trying to get them to just loosen up and have some fun. So as much as we could build in some fun, we did that.
Well, if you don't mind, I'm going to make sure that we distribute this presentation to all of the grantees and partners, because I think it's a basic onboarding orientation type of discussion that would be really helpful to everyone. So thank you so much for sharing this information, the tools, and your
my pleasure.
process. It was really great.
Thank you.
And
My
another
pleasure.
follow-up to that, Leanne, are you writing an article about this process? Because this would be a wonderful article.
I have not started. I've been wanting to say that between COVID and the grant, I've been pretty busy. And yeah, so it's my goal is to
So
write.
it has crossed your mind. That's good.
Yeah.
Okay. Well, thank you. It's hard to move on from that wonderful discussion, but I'm going to go back to the agenda. And please feel free, everyone, to follow up with Leanne if you have more questions. But the next thing on the agenda was just a brief check-in on any updates on the participants in their performance measurement activities. So now's a chance for you to just share if you're having any challenges or successes. And also it's a time for you to share and brainstorm with others. To get us started, I just want to share briefly about some activities that Susan Summers and I have been engaged in, and that is the Innovative and Exemplary Program Review. We can't share right now the programs that have been selected, but one of the things we note with the Innovative and Exemplary Services is they have good plans for collecting data and for really monitoring the performance. We have some great examples we'd like to share, but it is really a keystone of exemplary programs, is that whole evaluation of activities piece. Susan, do you have anything else to share about that?
Well, it was just making me think about the initial comments in the chat about like, what measures do we do? How do we know we're doing this correctly? And I think one of the things that we see in programs is of course, they use the client satisfaction and look at some outcomes, but the really strong programs are able to chart and document everything they do all along the way. And they do so in novel ways. So like when you asked Leanne about the interview protocol, sure enough, she had a script. That's a kind of measure. She's asking these questions with fidelity. Leanne, you can chime in here if you want to, but you probably figured out which questions got you good information and which questions helped you form a relationship that might continue. So that coming up with a protocol, that's like an important thing. So you have to think, I think, holistically about measurement. It's not, if you only measure the outcome, but you don't know how you got there, whether the outcome was good or bad, you can't repeat that outcome with confidence and with intentionality. So that was the one thing that Cassandra and I both noticed, that programs measure and use those data like immediately to make services better, to adjust services, to guide what their training is. And at some point we'll make a list, Cassandra and I will make a list of all the tools that we see both in programs and at state level. So you'll be able to select things that work for you. But yeah, think beyond just doing the satisfaction questionnaire at the end.
And they go beyond performance measurement is part of their services. So it's not this big burdensome thing. They build it in, it's basically part of the services.
Yeah.
So they may be keeping case notes, but they're going to do that anyway. And they just more thoughtfully
Yeah.
track.
So like an intake, which you all do with the voucher programs do, you're assessing the needs, and a lot of the programs do matching. So they assess the needs and preferences of their volunteers or their staff in order to match. That's all measurement. We don't always think of it that way. Then you go back and check and see the extent to which preferences have changed for caregivers or circumstances have changed for the volunteers. So they're just keeping track of all those things to make adjustments to make services better.
So anyone else want to share? I think sometimes it's hard to follow and act like Leanne's too, because it's so thoughtful and detailed. But anyone else having successes in measuring performance that they'd like to share, or a challenge they'd like to put on the table? I've been told I need to be more comfortable with silence. What I want to do now, if that's okay, then is switch over. A long time ago, when we first started this collaborative, Marilyn had said she wants to talk about the difference between outputs or outcomes. And what I did is I put together a presentation, but before I share that presentation, it's pretty brief. I wanted, Marilyn, could you explain others, how do you define outputs and outcomes? And I'd like to hear others, and feel free to go off mute or you can put it in text, but I'd like to hear, Marilyn, how do you define them?
Well, Cassandra, I wish I'd brought my logic model with me to this meeting, but I think it was very helpful. Leanne's presentation was phenomenal.
Wasn't it?
And it was helpful for me to hear what Susan just said about, we forget about documenting the details of process as performance measures. I think we think in terms of outputs don't really matter. It's the outcomes that matter. And what I'm hearing from this is both matter. That outputs are activities that help us accomplish outcomes. And outcomes in what we do can be pretty long range and pretty fuzzy, if you will. But those details about how we got there and things like, I mean, the example of the script used in a focus group as an output, but also kind of a mid-level outcome. I mean, so that's kind of what I am always struggling with is because so much of what we do takes so long. Systems change is such a lengthy process that how do we make sure that we're not setting ourselves up by having such long range outcomes that we get lost along the way. And so that's kind of what I have struggled with. This was very helpful for me in terms of maybe looking at some of those outputs a little differently in terms of measurability and documentation and those kinds of things that help move us incrementally towards those outcomes.
Thank you.
I don't know if that's what you were after.
Oh, well, basically you define outputs and outcomes similarly to the way I do. And I would like to right now, unless other people want to share their definition of outcome or output, I'm going to share my brief presentation, which okay, let me see, share. There we go. Let me just put this. slideshow. And I'm way ahead of myself. I want to go back to the beginning. Okay. So this is just briefly outcomes versus output. And the way I see outcomes is that it's movement towards or the attainment of a change in belief or behaviors. So what has changed as a direct result of your activities? This is the way I usually look at outcomes. And in terms of system change, what has changed in the systems you work with as a direct result of your activities? So what is now different? And by the way, I'm not going to talk today too much about indicators, but when you ask yourself the question, how do I know things have changed? It can be, what indicates that can be outputs. We'll get there a little bit later. So it's really hard to envision change, but if you conduct your services and succeed, what are the changes in beliefs? So that's a short-term behavioral change. It's your beliefs, your attitudes, and then later on, your behaviors. And then what one or two changes do you believe will occur as a result of your activities? So when you envision change, you look at the services you provide and what do you think will be different as a result of them in the future? Usually we look at outcomes, sorry, I'm going to move on. Outcomes in terms of short-term, intermediate, and long-term outcomes. Short-term outcomes are like engagement. Now, you're going to see right now that there is an overlap with outputs, especially in view of Leanne's activities that she just described, because it is an outcome to gain trust, interest, and involvement of a group. And that means tracking numbers of people who come, tracking their interactions and their networking with each other. And that could be called an output as well. But those short-term outcomes and tracking those numbers, gaining trust, interest, getting them involved, overlaps with outcomes and with outputs. So the short-term outcomes is that engagement, and then the learning. Changes in knowledge, attitude, and belief is another short-term outcome. And I'm going back to Leanne again. She talked about how they didn't know each other. They had to learn what other agencies were doing. They had to learn, oh, you describe respite this way. This is the way I describe it. So that is, again, a short-term outcome. The long-term outcomes, as we know, are going to take some time. And you really need to go through these first steps before you even get there. So then the intermediate outcomes are moving from learning into action, initiating new practices. So we've learned about each other. Now we're going to start networking. Thank you so much, Leanne, for giving me some fodder for this, because now we're going to maybe the moving from learning to action might even be that storming phase a little bit. And then practicing and refining activities, and then adopting or changing behaviors is sort of the intermediate step. The long-term outcomes are usually, I consider that integration. We are integrating new practices, new relationships, and now our whole system has changed as a result of this. We're consistently practicing new skills and behaviors, and hopefully we are always adjusting and refining what we do. In other words, we're using continuous quality improvement. So this would be a long-term outcome. Now, outputs, so those outcomes are the changes we want to see. And when we usually talk about outputs, it's those quantifiable events or products provided to meet a goal or an outcome, such as respite hours received. People usually think of that as an output. We provide these hours. How many meetings did we hold? We provided these meetings. How much money do you have? What was contributed? How many trainings did we offer? How many partners did we engage? We often look at that as outputs, but I argue that those are necessary steps. They count towards outcome. It is an outcome to increase the number of hours provided. It's also an outcome to have meetings where partners can meet together. So I think what I say is it's an art and it's not a science. Determining the difference between those. So if my stated goal is to increase membership in my coalition, if that's my goal, an outcome could be increased membership. I can call that an outcome. Some people would say, wait a minute, that's an output, a number of members, but it serves to meet that goal. And basically, this is my bottom line, you decide as a program or your funders. If your funders say, hey, no, you got to state it this way, you can't call that an outcome, you got to call it an output. If that's what your funders are saying or your board of directors, then word it that way, as you see fit. But I think what's important is when you're developing a logic model or you're setting goals for yourself and you're identifying what information to track and count, decide what's logical for your program, what's useful, what is really important, and keeping in mind that it's an art and it's not a science. So that's sort of my take on the difference between outputs and outcomes. So Marilyn, any thoughts on that?
Oh, I think that's very helpful. And I think what I wrote down, the key thing I wrote down is the overlap between outputs and short-term outcomes. And I just think we have to think in that way and what makes the most sense with what we're doing at that point.
Yeah.
Thank you. That's very helpful, Cassandra.
Are there any other comments on outputs or outcomes? Anyone else struggling with that? Can't believe it's already 11:18 or 11:20 just about.
Cassandra, I had a thought when you started out, you talked about directly affecting change. An intended outcome is a direct result of something that you've done, which is true. But I think it's also important for us to remember that there can be unintended consequences. There can also be second order effects. And I was thinking about one of the best practice programs that we identified a couple of years ago, was a faith-based program that served children with disabilities, served the caregivers. They had a night out, and they organized this at the church, I think quarterly. And it was like such a big, happy event that it raised awareness about disabilities in that church's community, and inclusiveness of the community was raised exponentially. And then there were more natural supports for those families and inclusion in regular church activities so people could attend. So here's like something you think you're just giving care for a night, but if you start asking around and start observing, and then in this community, because it was in the Bible Belt, a whole bunch of other churches replicated the program. So you see this, like one little thing that you've done had really important consequences for a whole community, which was lovely. And
that brings us to tracking things you observed, case notes, A lot of us think that evaluation or measurement is a checklist or a questionnaire. But how do you know what to ask if you're not really observing all sorts of other things around you?
And the observations help explain the results on the surveys.
Yeah.
The surveys are really important. Counting is important, but talking to people helps you understand the deeper meaning behind those numbers.
Right. And it also helps you know what to count.
Right.
That's so it goes around. Any other comments? This has been so useful to me. Leanne, again, I want to thank you, and Marilyn, thank you so much for your input. What I would like to do now is just move around to future meetings. And what I was thinking, I've been sending out doodle polls, trying to identify a good time, and we've all agreed quarterly we'll meet. I just want to hear some feedback from you. I'm thinking what I'll do for this next poll is send something out asking, do you want the first Thursday of every quarter? Do you want the first? I'll give you some choices there rather than just identifying different dates each time. Anyone have a thought on that? The best way to schedule these? Or what would be most useful to you?
Sandra, I think that would be a good idea simply because all of us have such crowded calendars that if we can plan out that way, and it makes it easier on you without having to send a doodle poll out every time.
Anyone else? Thank you, Marilyn. You just saved me a lot of time. Does anyone object to doing it that way?
No, I would prefer it.
Oh, good. Okay.
It might be helpful, Cassandra, to know if there's a day of the week that's right now better for everyone to meet
Hey, yeah,
regularly.
put that in chat or unmute yourself and tell us what is the best day. Or on the other hand, what would be the worst day you don't want to, but just let me know, and you can put it in chat or, and of course we have to consider East Coast, West Coast. So. Avoid Wednesdays and Fridays. Tuesdays are worse. Well, we're now at Monday and Thursday. Any day that ends in Y. That that's good. Okay. I have a feeling that Thursday may be the day, and that's what we've been doing. What I'll do now is after this meeting, I'll send out something with some possible times and months. I think if we just say every third month, and I have a feeling it's going to be on a Thursday. This time period is what we've gone with for the last 3 times. So probably it's our best time. Again, I'm going to send out and let you have some choices around it though. So without further ado, we're 6 minutes early. Anyone have anything else they'd like to add?
I just want to say again how excellent that presentation was, Leanne.
Oh,
Kind
thank
of
you.
over.
Thank you.
Okay then. Thank you everyone, and thanks again, Leanne.
We'll see you all at ISPA.
My pleasure.
Yes,
Yep.
it is,
Thank you.
yeah.
Happy
Bye-bye.
summer, everyone.
Thanks.